fundamentally what the NHS is about. They are at the core. Without the 6 Cs, there is no National Health Service. It's very simple.
So the 6 Cs are really about how we're going to improve the quality of care and make sure that every patient has a great experience of care every time they use the NHS.
The 6 Cs have to be very personal. The 6 Cs are something that you feel in your heart, you know, who you are and how you operate as a human being, not something that people externally tell you have to do to be a good nurse or a good leader.
It is about the culture change of understanding what really matters to patients, and it's about providing, you know, courage and compassion in everything that both the staff are doing, but also thinking about what really our actions affect patients. So there's kind of two aims really, about redefining what quality is in mental health and learning disability services, and recognising that the quality of our relationships with our colleagues will also affect our relationships with our patients.
It's the courage to stand up and not be afraid to sort of rock the boat, not be afraid to be a bit radical, and actually we have to change. We know we need to change. We want to make sure that patient care is improved. We want to make sure patients are involved in that care. And it's about having the courage to make sure that patients are involved at every level.
Much of what we hear from people with disabilities, particularly a learning disability, is that communication is something that really causes a barrier to their healthcare.
As an engagement manager, the 6 Cs is a really important way of liaising with our nursing colleagues, but more importantly telling members of the public and reinforcing to the members of the public what the great work that the nurses do, and also to allow the nurses to play a bigger role in healthcare in our area. We work with our lead nurse Tricia at South Cheshire, and we've been liaising with Homestar to create better communication for the parents that they're working with. So myself and Tricia have embedded communication where the nurses are going to go out and work with some very young mums about some basic life saving. So it's embedding their skills in a real way in the community outside the practice. And it's great because it's given the nurses a much bolder role in coming to us and saying, can you help us with this? We want to do this. How do we do that? So it's really motivating, and it creates a really great collaboration between us both.
It might not be obvious, but 6 Cs has an important place in how we adopt and use technology and innovate in nursing practice. For example, if you're using technology in a patient's home, it might be that you can provide more personalised, compassionate care in that person's home environment. And technology can also help us to do more interesting things, like be more responsive to people's information needs in the home.
Well, the difference it's going to make to patients' lives in the long run is actually that we're seeing the behaviours that we want to see from the workforce generally. And that's not that they haven't been there before, but people perhaps not understanding how their own humanity, if you like, might actually impact on what they bring to work and how they interact with patients.
I would expect all levels in all organisations to challenge those 6 Cs and, you know, and have those values and wear them with pride, really.
It's often important to remind people of why. It's just an orientation thing. You know, running in the background of everything that we do for and with and in the NHS should be the 6 Cs. So it's not really a campaign, it's more a constant message about what we're doing and why we're doing it and why the 6 Cs are important.